They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital.
Paying that cost right now. There's no longer a country that the U.S. most mirrors because we have claimed the top spot in terms of growth rate and speed to the highest number of cases. A couple of weeks ago, we were on the trajectory that Italy was on in terms of the growth rate of cases, in terms of the explosion geographically in the number of individuals that are infected with COVID-19, in terms of the risk to the healthcare system.
Oh yeah, you're a I'm talking about the grocery store clerks, cashiers, nurses, doctors, nurses assistants, food delivery drivers, post office workers, bike delivery, train operators. You know who you are.
Continue our health segments this morning. The focus is on occupational therapy in a COVID-19 atmosphere. With us this morning is Philippa Rule, occupational therapist at the Public Hospitals Authority. Welcome to the morning edition.
Thank you. Good morning.
First, tell us what exactly is occupational therapist?
Well, occupational therapy is a science-driven profession that helps people do the things that they want and need to do. We use everyday activities, but we analyze the activity to see what skills are necessary for that person to be able to do that task. Occupational therapy, we are
perspective, that is very hard because first of all, you have to have social distancing because that is the CDC guidelines, but you are also going to be exposed to the things that they're telling you should not be exposed to.
You just heard from one of the 115,000 occupational therapists nationwide that have been affected by the COVID-19 outbreak. According to the New York State Department of Health, 28 of them work for Cattaraugus County. Since occupational therapy involves specific training requiring the patient's presence for effective treatment, social distancing forces them to use telehealth, which so far has proven to be non-effective.
When you're in a telehealth, you have to be very, very cautious about what you're asking people to do because simple things are fine, but more complex things, you don't want somebody to do something that could inadvertently cause harm.
Heather McCroy Coppola, an occupational therapist in Cattaraugus County, sees eye to eye with Holiday and believes social distancing will continue to have a negative effect on occupational therapy in the county.
One of the problems is our caseload is going to drop. All of the therapists that have work in the school, right now they have no kids to work with because there's no kids in school. Their caseload is dropped, it's gone. And I can tell you that ours, even in the clinic, is way down because the doctors are no longer doing elective surgeries, and we have a lot of people that come for therapy after elective surgeries, which would be like anything that's not life-threatening. Anything that you can schedule when it's going to be. They're not doing any of those right now. So we're not getting new patients. So our caseload is dropping. It's going to affect everybody who works in the profession, physical or occupational therapy. We're not the most effective through telehealth. We're most effective in person.
In the meantime, they plan on using the telehealth program Doxy.me to meet with any of their patients that require virtual care.
The cons of teletherapy for me have been that some families have been reluctant to get on board with teletherapy when this option rolled in. This was likely because they didn't feel comfortable leading the session, or they felt like their child was not very good at attending to someone through a screen, which I understand, but I have had some families come back and say, we'll give it a try, and it's worked out really well, or we've been able to address the behavioral concerns as to why the child didn't want to maybe listen to the parents' instructions, and that's been really great for the child's overall progress. So there's that. Also, just generally, not everyone has the same access to technology. Some parents may only have phones, while other parents might have the webcam desktop access. This is also going to be different depending on the circumstance of teletherapy. So normally teletherapy requires more of like a HIPAA compliant webcam application, but
Yeah, you're a saint.